Welcome to your breastfeeding journey. I am part of the lactation team here at Madison Memorial Hospital. We're excited to help you with your breastfeeding needs. I would like to take a moment to cover some information about what to expect with feeding your infant. First, please let lactation staff or your nurse know of any health history or breastfeeding history that would help us with your breastfeeding needs. Have you breastfed before? If so, how was your experience? What are the breastfeeding goals? Do you have any health concerns with breastfeeding? Are you taking any medications outside of delivery medications that could possibly affect breastfeeding? Will you resume your medications after delivery that could affect breastfeeding? Thank you for answering these questions. It helps us support you and your goals with breastfeeding. First, feeding frequencies. The expectation for feeding your infant at the breast is every 2 to 3 hours. Waking your infant with gentle waking stimulation if needed. Please do not let your infant sleep 5 to 6 hours at this time. Each feeding should be about 10 to 20 minutes, alternating from each breast. Your infant will start eating from each breast every 3 hours in about 7 to 10 days. The hospital has given you a feeding log that looks like this. This is to help track feedings for the first week of life. We would encourage you to find an app or a journal and continue to keep a log of feedings and wet and messy diapers for the next few weeks. This helps all healthcare providers know how your infant is progressing. Colostrum to milk. The infant's first food is colostrum. This is a thick yellow substance that is in small amounts. This is perfect for your infant and the amount of nutritional needs. Your milk will take 3 to 7 days to come in. Your breast will feel full and heavy. Your infant will make more swallowing sounds when at the breast. If you have any concerns about milk supply after leaving the hospital, seek lactation help. There are multiple options for you in this area. Feeding cues. There are 3 stages of feeding cues that you will learn quickly. Here is a quick review of them. Early cues. They are just starting to wake. They are looking around, smacking their lips, and starting to stretch. This would be a great time to bring the infant to breast. They are calm and eager to learn. Mild cues, they are stretching more when their hand goes to their mouth and they are rooting and giving off feeding signs. They will have a lot more body movement. Late cues, the infant will start crying, seeming agitated and flailing their limbs. At this time, offer breast or feedings. If the infant is in late cues, there is a possibility that the infant will not settle to feed. Try using calming techniques, cuddling, skin to skin, rocking, and soothing. When the infant is calm, offer the breast at this time. Feeding time is cuddle time. This is a time that all should be enjoying their time together. If it is a stressful time for you and your infant, please seek help from a lactation specialist. We have a list for you to take home. Breastfeeding positions and comfort. Hopefully you have been shown 1 to 2 different positions for breastfeeding during your stay here at the hospital. When you're home, find a comfortable chair and space to set up for breastfeeding. Make sure that you have your water and snacks close by. Relax. Enjoy your time with your infant at the breast. The first few times you feed at home will feel different than when you were at the hospital. The positions will feel a little different. Please make sure that you are supporting your infant and that you have plenty of pillows. There should not be pain at the nipple or at the breast. There will be a strong pull at the nipple and some sensation at the breast as your milk is letting down for feeding. Breastfeeding is a learning time for both you and your baby. Engorgement and mastitis. Engorgement is a phase when milk is coming in and the breast will feel full, heavy, possibly warm to the touch. The breast can feel tender and lumpy to the touch. Be sure to wear appropriately fitting breastfeeding bras. Please do not wear sports bras at this time. Last, use light reverse massage in a sweeping or circular motion. Please offer the breast to the infant after the breast massage to help relieve the pressure. Follow the feeding with the use of ice. Engorgement can last 3 to 5 days. Mastitis. This is a small breast infection that can be treated with most antibiotics in most cases. If mom is running a fever over 100.4 or higher with breast tenderness, that is consistent with no relief from feedings or from ice, please contact your healthcare provider so you can receive help. When returning to work and school, your main goal is to protect your milk supply. Having a breast pump to help remove milk at times when you are not able to bring your infant to breast is most helpful. Most insurances will help pay for a breast pump. Please check with your nurse or lactation consultant to see if you qualify for a breast pump. When pumping, you should pump close to the same number of times your infant will feed. You will need to pump for 15 minutes on a minimum. Breast milk storage. CDC recommends fresh pumped milk is good for 4 hours on the countertop, then up to 4 days in the refrigerator. Pumped and frozen milk needs to be used within 6 months. Up to 12 months is acceptable. Please know that no matter how long you choose to breastfeed for, there are many benefits for both you and your baby. The CDC and FDA do recommend for your infant to be on breast milk for up to 2 years, whether you choose to breastfeed or pump and bottle feed, or a combination of both. Breastfeeding is a personal choice for you and your little one. Thank you for letting Madison Memorial Hospital help you on your journey with breastfeeding. I would like to take a brief moment to talk about formula feeding. You might choose to formula feed or need to supplement with some formula for a short period of time. We are here to support you and your infant. I would like to review feeding positions for your infant: holding upright or holding onto the side, offering the bottle with pace bottle feeding. Pace bottle feeding helps the infant take the feedings at a slower pace and helps them learn to control the flow. Please reach out to your nurse or lactation specialist if you would like to have techniques shown to you. When bottle feeding, never prop a bottle and make sure to feed your baby with pace bottle feeding method or with their head up with at least a 45-degree angle. After bottle feeding, most infants will need help with burping. You may place your baby in your lap in this degree or your shoulder, or sit them upright. Whichever is most comfortable for you and your baby, gently pat or rub the infant's back until infant burps. Some babies require more frequent burping than others and may need burping in the middle of feedings. Other babies can be very difficult to burp and may benefit from sitting in a swing for 20 to 30 minutes or holding or walking around the room with the baby after each feeding to help get the air bubbles up. Formula prep and storage. Formula comes in many different forms: ready to feed, concentrate, and powder form. Please be sure to read the formula prep information on the label for proper prepping needs. On the formula labels, there will also be storage needs. Please follow these guidelines. Formula is sensitive on how it is handled and stored. Pacifiers. This is a personal parenting choice. If you choose to offer your infant a pacifier, please offer after feedings. Thank you for letting Madison Memorial Hospital help you with your little one. Congratulations.